and its director, Jill Sankey. The Drexel University Dornsife School of Public Health and faculty member there, Rabbi Nancy, I have your name spelled wrong, Epstein, who is a professor in community and health and prevention. And my colleague and co-host, who you see on the screen with me, Jennifer Beard, who will share some information and intros in just a few moments. Just some really quick Remo housekeeping pieces of information. If you haven't yet, please visit my profile up at the top right of your screen. Add your full name, we recommend pronouns, and any affiliation or organization. Many of the functions that you may be used to in Zoom are available here. There's private chat. You can go to the chat and private chat with an individual. There's the room chat, which is called general chat. And then there's a table chat, which is where you are seated at a table with 5 other people. You can toggle between tile view, which is where you would see all of your faces sort of in a larger screen and you would lose the view of the floor, or floor view, where it will move your faces up to the top and you can see the floor of the room. You can do that at the bottom on the left. You can also still chat with your table mates during presentations through the table chat, though you cannot speak to each other during the presentation. Your cameras and microphones will be muted. To take notes during the discussion, please use the whiteboard. That is what is permanently automatically saved. So any notes or thoughts that you have there, if you type them or write them on the whiteboard function, those will be saved and documented. Feel free to make notes also in table chat, but if it needs to be permanent, use the whiteboard. If you have questions about functionality or tools, you can private chat with Sarah Collins or go to floor 1, the top left table labeled Remo Help Desk, and speak to Sarah or Dot, who will be there. To see the agenda and discussion questions, you can click the calendar icon at the top right of your floor screen. Before we get going today, I would like to take a moment to acknowledge that here at Boston University, the land currently known as Boston is the ancestral, unceded homeland of the Massachusetts people and their neighbors, the Nipmuc and the Wampanoag. We acknowledge the painful history of settler colonialism, genocide, and forced removal from this territory, and we honor, respect, and celebrate the many Indigenous people still connected to this land. We also have publicly committed to working to end continued systems of oppression and violence against Indigenous, Black, and other people of color. If you've never learned who the Indigenous ancestral inhabitants and stewards of the land that you are on you can do that at native-land.ca. And we encourage you to explore that full history. Now we'd like you to take a moment and in the general chat, note whose ancestral homelands you are on if you know it. So please feel free to go to general chat and click and share that information. We have more from Massachusetts people, the Lenni Lenape, the Munsee Lenape, the Chinook, the Kootenai, Catawba, Tongva. Wonderful. I encourage you to keep reading through those and take a moment to honor and respect those ancestors. Now I'd like to let Jennifer speak. Jennifer is a friend and colleague who I've worked with here at the School of Public Health, and she's going to share some more information with you.
Welcome, everybody. My name is Jennifer Beard, and I'm a clinical associate professor here at the Boston University School of Public Health in the Department of Global Health. And I'm truly delighted to be co-hosting this mini symposium with Ty. Last year, we collaborated with the Activist Lab, which is here at the School of Public Health, to bring Rodessa Jones, a theater artist and the creator of the Medea Project, to the School of Public Health as our first ever artist in residence. Having Rodessa with us for a week fed a hunger within our community to explore ways to communicate and invigorate our science, teaching, and outreach through creative expression. Today's event continues and extends our collaboration in new directions and with new partners. I have the honor of introducing our first speaker and the Dean of the School of Public Health, Dr. Sandro Galea. Dean Galea has been an early and leading voice in the conversation about how the arts bring life to the ways we think about, teach, and do the work of public health. He's certainly inspired me. Without further ado, I would like to welcome Dean Galea to start today's conversation.
Very good. Well, thank you very much, Ty and Jennifer, for inviting me, and thank you everybody for. It really is my great honor to be here with you. So, in the 10 minutes which I'm going to spend in this presentation, I simply would like to make one fundamental argument, and the argument is this: is that the arts can and should be at the heart of the public health enterprise. Now, to make that argument, I start with how we define public health. Fundamentally, public health is a collective act aimed at assuring that populations are as healthy as possible. This requires a reckoning with what it is that makes population healthy to begin with. I argue that the health of populations is a product of multiple levels of influence. Political decisions beget policies that ultimately affect health. Our health is influenced by the conditions of the cities in which we live and by the state of our neighborhoods, the places where we live, work, and play. While our behaviors, whether we exercise, eat healthy foods, refrain from risky behaviors, clearly have a role in shaping our health, many of these behaviors are constrained and shaped by these same environments. We are more likely to exercise if we are living in a safe neighborhood where we can walk without fear of personal harm. Therefore, the health of populations is a product as much of the world around us, the conditions that characterize where we live and how we live, than it is about personal characteristics or certainly genetic predispositions. To illustrate this, to move it from the abstract, perhaps let's take a concrete example. Let's take the challenge of non-communicable disease like heart disease or cancer. One of the central risk factors that has driven a rise in NCDs in the past decade has been an increase in obesity. Obesity is in turn influenced by federal policies, for example, that incentivize the production of calorie-dense, nutrient-poor foods. It's also influenced by the availability of healthy foods in local stores. We know that there are food deserts endemic in low-income neighborhoods. And ultimately, obesity is influenced by education. I could go on, but you all get the idea that a forward-looking conception of public health puts public health action at the heart of a multi-level, life course-based understanding of how health is produced. While this approach to public health is, I suspect, at some level intuitive, it's also a departure from how public health has operated for most of the past several decades. Public health for several decades has focused on embedding a notion of personal agency at the expense of a more sophisticated understanding of how all our actions are ultimately produced by nested influences, absent action on which we will fail in our efforts to improve the health of populations. So therefore, a forward-looking public health recognizes this and engages with action at all levels of influence that determine the forces that shape health. The forces that shape health include politics, power, place, the role of deep-seated historical forces like racism and misogyny, violence and structural inequities in wages, limited affordable housing, subpar public educational systems that preserve and deepen social and economic divides. These forces are far outside the scope of traditional public health, and indeed most academics within schools of public health. But I argue that if we are to improve the environment to the end of improving health, we must be able to bring along partners in these sectors who understand, and the key word is understand, that improving these sectors will improve health. So a vision of public health as one that engages multiple sectors, aiming to improve circumstances that surround us and conditions that affect us over the life course, must rest on improved understanding of health, extending beyond the shores of traditional public health and needing to engage more broadly with a rethinking of health, fundamentally challenging what we as a society talk about when we talk about health. This is where, to my mind, the synergy between the arts and public health comes in. Art represents the aesthetic representation of human creativity, be it in visual or verbal form. It provides an expression of complex human emotions, an opportunity to elevate our ideas and represent them in a form that's accessible to all of us. In many respects, art depicts concepts and ideas that cannot be portrayed in other forms. It captures who we are as a species and, perhaps better yet, who we wish to be. In so doing, art gives voice to how we think and see the world in a way that no other human expression can. This gives art the opportunity to shape our collective thinking, to frame unconsciously our conversation. Now, insofar as art has played a role in shaping the health of populations thus far, it has largely been to reinforce our understanding of health at the individual level. Graphic representations of disease warning and exhortations towards healthy behavior abound. This certainly plays a role, but it falls short of a more ambitious view of health, one that asks us to engage sectors outside the typical health domains of medicine or preventive individual health, to the sectors that generate health across the life course, to represent how safe housing, good schools, livable wages, gender equity, clean air, drinkable water, a fair economy are all key elements of generating health in populations. So how does art help bridge this gap? Aiming to be a bit more concrete, I suggest 3 steps can help us achieve this goal. First, efforts to bridge the gap between art and public health are needed, where artists are engaged in conversation around the production of health and vice versa. I think a mini symposium like this is a perfect example of what we need to do to move that conversation forward. In some respects, artists and public health professionals are 2 groups that speak different languages, starting early in our education, where children who are interested in art follow different educational paths than those interested in science education, with even fewer opportunities for intersection through the educational life course. This makes it difficult for us in both groups, artists, public health professionals, to engage in conversations, and this calls for formal efforts to bridge that gap, joint programs and efforts to bridge field to translate what each group knows to bring the 2 groups together. Second, both artists and public health professionals could benefit immensely from interventions early in the life course, from education early on, starting perhaps in elementary school, that tells a more expansive story of health, that creates a narrative that shifts the conversation early in childhood, narrowing the gap to bridge when artists and public health professionals are well ensconced in each of their professional spheres. This is a long-term effort that will require teaching in schools that presents a story of health, extends well beyond sick care, that has books at its disposal that educates future generations on an expansive view on health, and that encourages children from early years to think about how transportation and housing shape our health, to create a generation of native public health thinkers who will then carry forward an artistic expression that can further shift conversation in future years. And third, I suggest that it stands to benefit all of us to work towards melting disciplinary boundaries in our formal graduate education, where most public health professionals and artists receive their final formative training. This will require creativity on those within the academy and also among accreditors. Most graduate training programs in arts and public health must meet requirements set by accreditation bodies, often leaving little room for variation in syllabi and course requirements. This creates a dynamic that reinforces dominant paradigms with little opportunity for creativity in educational material. This would also require that faculty are rewarded for teaching outside of their home schools of disciplines, a flexibility that's often difficult to achieve within existing structures. So I'll conclude. I conclude by suggesting that creating a healthier world will require a retelling of the story of health. Art, in its role as a communicator of our better ideas, stands to play a unique role in that aspiration. There are substantial structural challenges that limit the role that art can play in engaging with public health. But there are also innovations. There can be the creation of formal efforts to bridge this gap, including efforts in the early in the educational life course and at advanced stages of graduate education that can help move us closer to this goal. I think if we achieve this goal, we stand to advance the goals, both of art and of public health. And I think symposia like this one are exactly the right step in moving the conversation forward. Thank you. Thank you for inviting me. Thank you for having this conversation.
I'd like to introduce Jill Sankey, our next speaker. Jill Sankey is director of the Center for the Arts in Medicine at the University of Florida. She serves on the faculty of the center and is an affiliated faculty member at the School of Theater and Dance, the Center for African Studies, the STEM Translational Communication Center, the One Health Center, and the Center for Movement Disorders and Neurorestoration. Jill serves on the editorial board for Arts and Health Journal and the board of Citizens for Florida Arts. She is also the director of the national initiative, Creating Healthy Communities, Arts and Public Health in America, in partnership with ArtPlace America. With more than 25 years of experience and leadership in arts and health, in addition to a career in dance, Jill is active in research, teaching, and international cultural exchange. Thank you, Jill.
Thank you, Mary Rose. Thank you so much. It's a pleasure to be here this afternoon. And thank you all for being here. Thank you, Dean Galea, for those inspiring words and that inspiring call. Dean Galea is an impossible act to follow, but I'm really honored to give it a try today. And thank you all for being a part of the conversation that we'll have this afternoon. So knowing that you all bring really wonderfully diverse disciplinary backgrounds and perspectives, I want to start with just a little more background information today to help set some of the context for our conversations. Over the past century, the field of public health has moved through several distinct waves that reflect distinct perspectives on population health. The concepts of health equity, root causes, and social determinants of health have been increasingly taken up in public health in the United States over the past couple of decades in what has been considered the fourth wave. However, even with this focus, much of public health research and practice has prioritized individual and interpersonal level interventions. Recently, many in the field have called for a fifth wave of public health, a paradigm in which the social ecological environment generates health through a holistic and collaborative frame. This fifth wave view recognizes that there's no single sector intervention or mechanism that can support health and health equity, as Dean Galea clarified a few moments ago. Instead, a focus on a culture of health across sectors, disciplines, policies, and geographies will increase the pace at which critical population health issues can be addressed. Within this perspective, we understand that moving the needle on population health requires collective action or social change, and that change has to take place around the upstream drivers of health inequities, such as racism, collective trauma, and many other systemic inequities. Similarly, the growing focus on health equity and public health highlights the need for approaches that support individual health and address upstream drivers of health outcomes, including structures, systems, environments, and policies. These kinds of interventions require innovative, collaborative efforts that are responsive to culture, to lived experience, and to community assets. And as a sector, arts and culture offers really rich ground for precisely such collaboration and innovation. So the arts have long been used as a means to communicate with the public, to influence behaviors, and to fuel social movements. Artists are influencers, both within communities and across populations. The arts uncover and illuminate issues. They engage us emotionally and intellectually. They challenge assumptions, they call out injustice, and they influence collective action. And we know that artists have long been agents of the kind of cultural, social, and behavioral change that we need today. From the explosion of artistic expression within the Harlem Renaissance, to the AIDS quilt in the 1980s, which raised awareness of the scale and impact of HIV, and the Broadway play Rent in the 90s, which played a major role in reducing stigma and increasing HIV testing, to Knitted Pink Hats in 2018, which cultivated solidarity and protest of the widespread deprecation of women by men in power, and the music and design that fuels both the Me Too and Black Lives Matter movements today. Public health calls this the diffusion of innovation, which is a behavior change theory. We also just call it art and recognize it as art doing what art does. And today, as so many people reach to the arts to cope with the social distancing and stress of COVID-19, the relationships between the arts are more visible and visceral than they ever have been. In this pandemic, the arts have been central to connection, coping, and communication, and now they're being engaged in recovery and rebuilding efforts too. Musicians around the world are singing and performing from balconies. People are flocking to massive online music gatherings like those that DJ Denice, Michelle Obama, and the CDC have collaborated on. In these events, people are experiencing joy and connection And the artists are using their platforms to communicate critical and accurate health information from agencies like the CDC. And I just love this one. Charli D'Amelio's TikTok dance about staying grounded and staying home has been viewed over 10 billion times, with 95,000 of those views in the first 10 minutes from its posting. This video has led to the creation of more than 3.5 million unique hashtag distance dance videos, which have collectively been viewed more than 15.6 billion times. This is truly powerful and effective health communication. And Charli was just named one of PR Week's 50 health influencers. In addition, collaborative community songwriting projects like the Lift Up Louisville project are providing communities with ways to experience connection in the midst of isolation, and are also better positioning those communities to collaborate in recovery and rebuilding efforts. Within this pandemic, the arts have been engaged for rapid and widespread communication by the World Health Organization, by the United Nations, by the CDC, and the NIH. Those agencies who lead our national and global health systems recognize that the arts can influence health behaviors and that they're essential to our well-being and resilience in challenging times like these. And artists are, as ever, rising up to express their own and collective outrage at the racism that persists and is a major public health issue in this country. I want to harken back to 1964 for a moment, when Nina Simone wrote the song Mississippi Goddamn, after learning that Ku Klux Klan members had bombed the 16th Street Baptist Church in Birmingham and killed 4 little girls. In response to this tragedy, Simone felt that she had to say something, in her words, to express or explode. She described ransacking her garage and trying to make a gun. And when her husband reminded her that she didn't know anything about killing, she ran to her piano and wrote Mississippi Goddamn in under an hour. That song was then recorded when she performed it in March of 1964 at Carnegie Hall in front of a mostly white audience. The recording was then released in a single, and as we know, became an anthem during the civil rights movement. It was banned in several southern states, and she then performed it in front of 10,000 people at the end of the Selma to Montgomery marches, when she and other Black artists, including Sammy Davis Jr., James Baldwin, and Harry Belafonte, crossed police lines. Today, artists like Beyonce, Dave Chappelle, and many others in the public eye are using their platforms to drive action. And artists in communities and even in local governments are doing so. I had the pleasure of being in New York this summer when the Black Lives Matter mural was painted in front of Trump Tower, and when dancing erupted everywhere in the streets as the election was called this past weekend. These works of art and these spontaneous creative actions matter. And today, as they have been throughout our human history, artists are driven to create in response to injustice and to drive critical dialogue to influence collective action and social change, and to make life better and healthier for us all. So today, as our public health systems are acknowledging and addressing racism as a public health issue, public health needs the arts to help make the changes that will create health and health equity. All right, so I want to shift gears and share some resources designed to drive and support cross-sector collaboration between the public health and arts sectors. Over the past 2 decades, we at the Center for Arts and Medicine have been working in partnership with ArtPlace America and many people throughout the country to build a field of arts and public health in the US, and to call for cross-sector collaboration to address critical public health issues. This translational initiative has gathered the knowledge of over 300 thought leaders and undertaken a body of research, including evidence synthesis, to create an array of resources that translate knowledge and evidence into policy and practice. One of the primary resources we produced is the Creating Healthy Communities Through Cross-Sector Collaboration white paper. This report focuses on 5 key public health issues: collective trauma, racism, mental health, social isolation, and chronic disease, and offers examples and recommendations for how the arts can address these issues. I want to take just a moment to recognize the amazing team of people who created this work. The work of this team also resulted in the development of an evidence-based framework for using the arts in public health. Developed through a complex 2-year mixed methods study and grounded in the social ecological model, the Arts and Culture in Public Health framework draws on the overarching goals of Healthy People 2030 and the Robert Wood Johnson Foundation's Culture of Health Action Framework to illuminate evidence-based links between arts exposure and participation and multiple health outcomes. As you can see in the blue boxes on its right side, the framework suggests that the arts can provide direct health benefits, that they can increase health service equity and access, that they can create safe, inclusive, and engaging environments, can support social, cultural, and policy change, can enrich research methods and practices, and can also strengthen health communication. And in the middle, it offers mechanisms by which the arts can do these things, including by facilitating self-efficacy, personal and cultural resonance, aesthetic experiences, emotional engagement and empathy, expression and being heard, meaning-making, and self-transcendence. The framework then expands to identify 59 different health outcomes that can be impacted by arts and cultural engagement or interventions. You can see a few of those key outcomes here. And you can also access them on the web version of the framework. On that website, you can see all of these outcomes, all 59, and key examples of the evidence that supports them. So since March, we've also created an array of resources as a part of our COVID-19 arts response, which include local, state, and national government advisory briefs, and an extensive COVID-19 arts response repository. You can use this repository to find artists, organizations, and projects, as well as media and other resources for using the arts to address COVID-19. So when we designed this national initiative 3 years ago with ArtPlace America, our shorthand for this work was that we would make arts and public health a thing in the US. We believe we've accomplished that, and seeing you all here today actually affirms that too. In addition to seeing a field of arts and public health emerging, we see a discipline emerging through the implementation of academic programs, such as the minor in arts and public health offered by the Dornsife School of Public Health at Drexel University, and the graduate certificate in arts and public health offered at the University of Florida. We're also seeing an upsurge in research reflected in 2 current supplemental journal issues focused on the arts and public health in leading public health journals. And just about a week ago, in the opening session of the American Public Health Association conference, echoing Dean Galea's call today, APHA President Lisa Carlson wrapped up her address with a call for cross-sector collaboration. She said, if we, the public health sector, are going to tackle huge issues that impact health like poverty and racism, the truth is we can't do that alone. The future of public health is cross sectors. I want to close by noting that both the public health and arts sectors have always worked to create stronger, healthier communities. But what we're missing today is the full power of their combined strengths. And as our public health systems more fully recognize and embrace the arts, the creative sector will grow, and cross-sector collaboration will bring fully to bear the power of the arts to create healthier and more equitable communities in the US and around the world. Thank you so much.
Next, I'd like to introduce Josh Miller. We are grateful to have Josh Miller join us as a leader, practitioner, and advocate in this space. Josh Miller is co-founder and CEO of Ideas X Lab, an artist-led organization named Nonprofit of the Year in 2019 by the Derby Diversity and Business Summit. He is a distance runner and cyclist, a 2-time TEDx speaker, and a CEO Action for Diversity and Inclusion signatory. Josh was selected for Business Equality Magazine's 40 LGBTQ Leaders Under 40 in 2020, and Louisville Business's first 40 Under 40 in 2018. So welcome, Josh, to this symposium. Thank you.
All right. Hey, everybody. And thank you, Mary Rose, for that introduction. Like she said, my name is Josh Miller, he, him, his pronouns, and I'm the co-founder and CEO of Ideas X Lab in Louisville, Kentucky. I'm really looking forward to being with you all and sharing our initiative with you as part of this symposium today. So we are an artist-led organization that is focused on championing inclusion and belonging through creativity, art, and action in support of a more healthy, just, and hopeful society. And the background image right here of this community event is part of our One Poem at a Time launch that we're going to talk about in just a minute. But we're going to start our journey together today in Senegal, West Africa in 2016. So my fiance Theo and I, along with a group of Black creatives and artists called Roots and Wings, went to Senegal for a 2-week cultural exchange. And from the art to the architecture to the advertising and communications, this was one of the first times that the Black members of our collaborative group that went saw themselves reflected back throughout the community as an asset. Even the angels on the churches had locks, so they kept seeing themselves reflected back in all of their glory. And one of the artists, Kiera, who you can see on the bottom right, said, "The world is so much better when you can see yourself in it." And so that journey and that experience together really informed how we thought about community engaged work and One Poem at a Time. You're going to hear from Hannah Drake, one of our team members and also a member of Roots and Wings who was on that trip, who was part of the spark that led to this initiative. And so as we came back from that trip, doing our work in Smoketown with community partners, Smoketown is the oldest continuous African-American community in the state of Kentucky. It's over 150 years old. And we were doing artist-led community engagements through drumming circles and poetry workshops, and really seeking to surface through the arts what the community priorities were. And some of those priorities that came up were beautification and safety. And so we asked, okay, so let's better understand what beautification means. And Hannah and I one day were out walking around the neighborhood, taking photos for the smoketownvoice.com website. And we were seeing all of the outdoor advertising, billboards for drug sniffing dogs and cheap lawyers and gun shows and signs for we pay cash for your house. And really started to think about that experience in Senegal, think about how does this messaging impact the community? Does the community notice it? And so that was one of the next questions that we asked. We asked, do you all notice that this concentration of outdoor advertising? And the community said yes. By and large, we notice it all the time. And one community member said that the content of the outdoor ads in that way made them feel like the community had low self-esteem. That was the message that they were getting about their community where they were. And that wasn't something that people shared that idea of. We are a proud community, we are a worthy community. And so how do we come together around that? And that is where One Poem at a Time came from. And so Hannah Drake, our chief creative officer and activist, a poet and author who has 4 generations of family history in the community, was helping to lead those community engaged events and ask the question of, what if we change the billboards? What if we change the messages on the billboards one poem at a time? And do that by working with community members. And so that is what we set out and embarked to do, was help and work with the community to envision what a change in the environment looks like and what the positive impact of that could be. And to think about what are the steps that we need to take together to get there. So as we were working through the beginnings of the One Poem at a Time process, working with community members to design the billboards, a health impact assessment was authored by the Louisville Metro Department of Public Health and Wellness, along with the Commonwealth Institute of Kentucky and community members in our team from Ideas X Lab through the Health Impact Project. And these were some of the things that had surfaced as we were thinking about what are the possible health and long-term community implications of a project like this, and bringing the community together to think about policy change. And so the work of Dr. Sean Ginwright around activism and radical healing talked about the same way that lead creates an environmental toxin, this type of high density outdoor advertising creates a social toxin, right? So this negative outdoor messaging can actually link to poor health outcomes. The HIA also talked about research that showed that changing the density and content of negative messaging could be a health protective factor to impact longer term well-being of a community. And also that an arts-based approach like the one that we were seeking to enact through Ideas X Lab supported the strengthening of social connections and community engagement towards health and towards boosting health in public spaces. And so all of those were things that we thought about as we developed One Poem at a Time and the ongoing work that we've been doing in collaboration with Smoketown partners. And you can read the full health impact assessment that looks at various facets of the work in Smoketown with our partners at ideasxlab.com/HIA. And so for the first campaign, we were really thinking about how is this an asset-based approach? How is it grounded in the language and the culture of the community as a communications tool, and to build community capacity to come together, to advocate for, and to determine what the environment that you live within looks like. So this billboard, You Are Worthy, Worthy of Everything, was one of our first billboards. This is a group of young people in Smoketown. And the You Are Worthy, Worthy of Everything really became a slogan for the neighborhood as we were thinking about how do we combat these different types of predatory commerce and come together to drive policy change at various levels across our community, across our city. And so these are some of the billboards from our first campaign, Healing Begins One Step at a Time. This was from a peace walk after the person in the middle in the hat, his grandson, was shot and killed in Smoketown. Lifelong Friendships Begin in Smoketown, a historical photo from archives, along with young people engaging together in an urban farm. And so these were all words of what do you want to say to each other, what represents the value that you see in the community and depicts you all as a community, your faces, your stories back to each other. And so as we worked to launch the project, we hosted One Poem at a Time historical poetry walk, engaging artists and cultural leaders to engage and tell the story of Smoketown by walking around the community with community members and policymakers, to see the billboards, to see the older billboards, and just start to have a conversation and culminate that walk in a conversation around policy change. So you can see community members out walking. We were outside of the Mazik Middle School. There was a drumming circle, and we also had State Representative Attica Scott. We had city council members. We had people from Louisville Metro government present. So really thinking about all of the different ways that communities can self-determine what their community looks like and starting that policy conversation. And as we were having this conversation around policy change or mitigating the impact of outdoor advertising, we looked across the street and 2 billboards almost overnight popped up, huge signs that they were about to start selling alcohol. And the current policy at the time really was minimal in terms of the notification process for community members who may not want additional places in their community to sell alcohol. And so because of how short the time period was, the policy focus shifted from the outdoor advertising to how do we defeat the 2 liquor stores that have applied for liquor licenses, but also get a change in terms of how are people notified so that you can, as a community, come together to advocate for places to be able to or not to be able to sell alcohol. And this is Nishan Tribune holding the Smoketown is Worthy of Everything fan. She's a business owner in Smoketown. She's a community leader. She's now with Bates Community Development Corporation. And she made the point that it wasn't about not wanting economic development, not wanting businesses in the community, but we want businesses that are positively impacting our health and well-being. And so by using the Louisville Center for Health Equity report, the health data there, over 5,000 letters were written. Both liquor licenses were defeated, which was a tremendous feat in and of itself, but it didn't stop there. And so 2 or multiple new administrative policies or practices almost immediately began. One are these large canary yellow signs, as you can see on the right. This was put up as businesses were starting to apply to be able to sell alcohol, which gave community members adequate time to be able to submit letters or voice any concerns. And we saw this almost instantly, which was tremendous, because Family Dollar, shortly after this began, that process began, 22 Family Dollars all applied to be able to sell alcohol. And because people could see that those applications had gone in part because of those signs, the community rallied, reached out to Nasham, reached out to other community members, used a similar letter writing campaign approach, and were able to get those liquor licenses defeated as well. Our council member also started emailing people every time someone within the district, a business, was applying to sell alcohol. And so there were different ways the community was now being informed beyond an ad in the back of the newspaper or a printer size sheet of paper somewhere on the building that said, we've applied for a liquor license. So that was a really exciting thing to see, and great to see that community capacity built out as we think about how do we self-determine what our neighborhoods and our communities look like. So like I said, Smoketown is worthy of everything has become the slogan. It's now a mural in the community, and it continues to this day to be something that has sparked a lot of pride and a lot of community engagement around, we care about our neighborhood and we want to see things that are valuable here. So Jill spoke earlier about the Creating Healthy Communities Through Cross-Sector Collaboration white paper, which also highlighted facets of One Poem at a Time. And it talked about the impact and said, One Poem at a Time brought Smoketown residents together for ongoing collective action against racist practices. And it exemplifies the ability of community-led, artist-based initiatives to generate changes that produce health now and in the future. So, building on that first campaign, we have gone on to do 3 more rounds of outdoor billboards. All 3 of these newer rounds have been in partnership with Louisville Metro Department of Public Health and Wellness. They were really excited to think about how community voice, community photos could be done in this culturally responsive approach to then disseminate public health messaging. So we've worked with everybody from young people at Mizzeke Middle School through the Justice League, burgeoning chefs from the neighborhood, people who have been in the neighborhood for decades, driving change with a variety of different focus areas. Still, community members, in their words, talking to each other, issuing a call to action, but it also being based in the assets of the community. And one of the great things about this, when people see themselves reflected in the community, those images, photos of the billboards didn't just live in person, they also moved online. So Clavetta, her daughter, is featured in this billboard. She helped to write the language that is on here. Clee is in their garden, and it was a great way for the community to gather online in another form to talk about the content of these billboards. Here's another one that Robin Garner, one of the poets that was on the poetry walk, is featured with Miss Shirley May. And so this was just a great way to amplify, continuing to amplify the message and take it beyond just a physical project, but into the virtual and digital space. So prior to COVID, we were talking to the Louisville Metro Childhood Lead Poisoning Prevention Project about a 4th campaign focused on childhood lead poisoning prevention. And once COVID hit, we knew that we couldn't do an authentic campaign and a community engaged campaign without recognizing the world that we are now in, the impact that COVID-19 is having, and also if we are asking people to stay healthy at home, what happens if your home can be the thing that's negatively impacting your health? For example, if you have young children and you have lead present in your home. And so we were able to evolve the campaign to include that COVID-19 focus and broaden it to be a healthy home, healthy community campaign. So we worked with Louisville Metro Department of Public Health and Wellness, along with the Bates Community Development Corporation, who was doing a summer camp in Smoketown. And fortunately, we were able to go for 2 in-person days before things needed to go virtual for the camp. But we were able to work with all of these young people and, by extension, their families to create this campaign. So obviously you can see everyone in masks. The young people each helped to take the photos of each other. And then we had a form that my team member Hannah Drake created, Healthy in My Home and Neighborhood, that the young people took home and completed with their families. So they were able to talk about what is a healthy home, what does a healthy community look like. They took lead testers home with them, which was a small spray bottle from Louisville Metro Department of Public Health and Wellness. They were able to test their homes, and then they were able to come back to the space, and we were able to work through what is the language and what are the visuals of these billboards look like in a time like this. And so you saw Nishan earlier, and she is now with Bates CDC, and she said this opportunity for Bates Community Development Corporation to be a partner has been a game changer for our youth. They had a chance to show their natural beauty and creativity in a world that has covered it up for 400 plus years. And so that's a photo I took of Nishan outside of Bates CDC for one of the latest billboards. And here's this billboard, which I love, is a mom and her daughters. This mom was part of the leadership of the summer camp. She took a lead tester home. They tested their home together. They brought it back. And so we really love to have that cross-pollination of the summer camp and things going home, and also the translation of this billboard into a digital ad, which you can see an example of on the left. And the great thing about the digital ad, especially with everybody being tied to their digital devices right now, is that ad performed at 233% above the industry standard for the 3-month period that we ran it, which was really exciting in terms of directing people to resources around lead prevention as we are asking them to be healthy at home. So this has been a great arc of work and very exciting. We've done over 30 billboards over the 4 rounds, 2017 to present, with communications areas focusing on community worth and justice, diabetes prevention, smoking cessation, childhood lead poisoning prevention, and more. And this engagement in particular around the lead poisoning prevention was also a great way for us to have some virtual community conversations, and for organizations like Bates CDC to think about what products are we buying, for children that may be made of plastic or other materials that could potentially have lead in them, and to go ahead and start to think about the items that we buy to then provide to youth, to families, and that being an added layer of awareness that was generated through this campaign. So what is next? What's on the horizon for One Poem at a Time? A journal article is being co-authored by researchers from University of Louisville Center for Creative Place Healing, led by Theo Edmonds, along with community members, including Nishan Tribute from Smoketown and our team at Ideas X Lab. And that piece is going to highlight the role of self-determination, hope, and belonging in this type of approach, which has been shown to impact both mental and physical health and well-being at an individual and societal level. And it will propose a framework for developing and deploying culturally responsive communications efforts with communities to impact health and well-being based on the approach of one poem at a time. So you can go to ideasxlab.com/OPAT to learn more about the campaign. Feel free to reach out if you have questions, if you want to learn more. And thank you all for your time. And I'm so encouraged to see everyone coming together through this convening today.
Okay, so Kendra Jones serves as Director for Health Equity, Arts and Culture for Richmond Memorial Health Foundation. In this role, Kendra leads the foundation Hearts, or Health Equity and Arts Program, which funds nonprofit organizations in partnership with equitably compensated artists working to identify and remove barriers to health through creative expression. She is passionate about art as a powerful vehicle for authentic storytelling, a tool for community connection, and even a catalyst for policy change. A frequent contributor and panelist on topics of art and health equity, Kendra loves communicating with value and impact of art on health at the individual, community, and systems levels. Thank you.
Thank you, Mary Rose. And I'm not sure how I'm going to follow Josh. Oh my goodness, so inspiring. I will like to take this moment to thank Sarah, who is behind the scenes and going to control the presentation for me. So thank you so much, Sarah. And you'll hear me say next just to give Sarah clues to progress with the presentation. So we're just going to stay on this slide for the beginning right now. And I'd just like to start off saying that Richmond Memorial Health Foundation began funding HEARTS, the Health Equity and Arts Program, in 2017. HEARTS funds the partnership of artists and nonprofit organizations to creatively engage community members in participatory sessions to elevate their voice, co-create solutions to the inequities they face, and to imagine a healthy and just Richmond, Virginia. So why did we decide to invest at the intersection of arts and health as a health legacy foundation? We have a board of doctors who just a few years ago would have rather seen our investments go to the safety net clinics in our regions. Next slide, please. And prior to the last few years, we did just that. We traditionally funded access to healthcare, but in order to address the social, economic, and structural conditions that contribute to poor health outcomes, we realized we needed to do more and look at health broadly with a sense of urgency, nurturing relationships, and working collaboratively to make an even bigger impact in our region. Next. So we first updated our mission to focus on health equity. We also did research related to the health benefits of a cross-sector collaboration between arts and culture and health, and learned a lot from folks like Jill and the University of Florida's Arts and Medicine program. And in 2017, we made our first investments in the arts by directly supporting artists working in the community to consider questions like, what does it mean to be well? How do aspects of identity such as race, ethnicity, gender, age, migrant status, and socioeconomic status relate to health outcomes? And what structural barriers exist to achieving states of physical, mental, and social well-being? Next slide. We wanted to be able to learn about the inequities that the communities we serve face and what was important to them from their perspective, and not as we had previously been assuming as a foundation led by people of certain privileges. RMHF's goal of hearing from those different voices was accomplished by projects that highlighted issues we were aware of, offering more insight, and some that we had no clue about. Okay, this is when it's going to speed up. Next slide, please. The subjects ranged from Latino communities and their dreams for the future and the obstacles they have to overcome to achieve them. Next slide. Youth in our community facing housing insecurity and individuals with chronic diseases relying on free clinics for care. Next slide. Young Black girls persevering despite false narratives that are perpetuated. That's a slide right there. And next slide, please. Women victimized by human trafficking along the 95 corridor, which is right in our backyard. Next slide. Communities facing food insecurity and the number of food deserts in the east end of our beloved Richmond. And next slide. And neighborhoods that are only a couple of miles apart, but have drastic differences in life expectancy. Next slide. Arts projects allow these communities, and quite frankly, us too, to imagine a future where these inequities do not exist. They were not done to give voice to the voiceless, but to give an ear for the earless. And we listened. The once blank canvas about the public's perception of equity was starting to be filled in by Richmonders that were not asked for their opinion before. And in 2018, the goal of HEARTS was to integrate the arts into our core work. So how did we do this? Well, we funded cross-sector, non-traditional partnerships of nonprofit organizations and artists in the underserved communities they work with to propose creative solutions in removing the barriers they face in achieving health equity. Instead of just funding the artists, this new approach created a bigger impact because we had more people at the table with these artists. And it allowed the nonprofits in our area to think about engagement differently. And that engagement came with all the health benefits for the communities they serve through the process of creating the art And it also increased civic advocacy with the co-creation of solutions with their final creative products. Next slide. We funded programs with teens exploring mental health through the use of invented characters, alter egos, and reimagined narratives. Next slide. There was a photo narrative project focused on Black women care providers to uplift their voices and promote self-care through story, poetry, and imagery. These women were so used to caring for others and always putting themselves last that it proved to be difficult in the beginning. But it ended with them collectively writing a poem, "Please Tell Me That You Can See Me," and advocating for a living wage movement for direct care providers at our city hall with the mayor and the Office of Community Wealth Building. Next slide, please. We also supported a pilot program for Black and Latino youth that deepened cross-cultural relationships. It helped with them practicing community building skills and developing civic advocacy skills. The final project added value to their community by enhancing the beauty and safety of it with street art, as well as bike path advocacy efforts by them in front of Richmond City Council. The youth now. Okay, next slide, please. This year, we made even more changes to the Hearts program. Our previous cohorts were just one-year funding opportunities, but Hearts 2020 is a two-year funding opportunity. So sorry about that. It's a two-year funding opportunity with a total investment that's 5 times higher than our original investment in 2017. We appreciate that real change cannot happen in 1 year, and 2 years is a stretch, but it's a great start for a health foundation for these types of partnerships. The current Heart projects represent a broad diversity of art forms and equity concerns. And here we are, we're going to go fast again. Next slide, please. We are funding folklore and undoing racism. Next slide. Fashion design and destigmatizing mental health concerns. Next slide. Visual art and dismantling the juvenile justice system. Next slide. Design and correcting the built environment. And next slide, please. Arts education and supporting youth development. Next slide. As diverse as the projects funded are in their interventions and stated outcomes, they are united within the frame of addressing structural and historic racism. And our review panel for Hearts funded projects lifted up racism as the #1 public health concern for our country. Now, this wasn't news for our foundation, and it has been made even more evident in light of COVID-19 and racial injustices with the murders of George Floyd, Ahmaud Arbery, and Breonna Taylor. There has always been an urgency to our work in promoting health equity, and we knew that we could not focus on health equity without talking about race and systemic and structural racism. So some immediate steps we are taking involves creating opportunities for people of color by making it a priority to fund Black and Brown artists and organizations led by people of color, working in the communities that are being so disproportionately affected. We are making these groups a priority going forward, not only because they have been disproportionately affected by COVID and racism, but also because they have been historically underfunded by philanthropy. When other funding opportunities for artists were being cut due to COVID-19, we doubled down. And we put a lot of money where we knew the healing and the feeling of not being so alone would happen. Next slide. And I am extremely proud of our Health Foundation for making that commitment. Thank you so much for your time. And my dogs, thank you too. Thank you.
Thank you, Kendra, and all the speakers. What a richness that's been shared in this first hour. I'm Rabbi Nancy Epstein, Professor of Community Health and Prevention at the Dornsife School of Public Health at Drexel University, and Director of our new graduate program, which is a minor in Arts and Public Health. We've just started our second year, and we're really thrilled about the minor and the opportunity to collaborate with folks all over the country to learn what others are doing at the intersection of arts and public health. So we've heard from Dean Galea and Jill Sankey and Josh Miller and Kendra in an array of perspectives about arts and public health, and now we want to hear from you. Because we know that to create and build a field of arts and public health, it takes all of us, and it takes all of us together. And together is really our watchword. And so to do that, we really need to hear and listen to each other. So we're going to break up into tables. You're already at a table here on this Remo platform. And we're going to take 25 minutes for conversations around three key questions. We'd like everyone to participate at the table, and the questions are to please introduce yourself and say where you're from and one thing of any choice about yourself. To share one thing that stuck with you or inspired you from the presentations this afternoon. And then one thing you'd like to see moving forward as we continue to knit together the worlds of art and public health. Thank you to those who filled out the pre-survey that was sent out in the last few days. We heard from 95 of you, and about half are coming into the conversation today through the doorway of arts, and half are coming in through the doorway of public health. And just 2 weeks ago, there were actually two conferences going on simultaneously: the American Public Health Association annual meeting and Art Place America's summit. And at both, we heard at the Public Health Conference conversations about art, and we heard at the arts conversations about public health. So this is a field that there is so much energy and enthusiasm right now, and our gathering today is evidence of that. So there are folks we've asked in advance to try and serve as moderators at the table. We've had a growing number of people who signed up. So if you don't have a moderator at your table already, or if by chance you have two, the moderator can click on another table and move. If there's no moderator, if you would ask someone at your table simply to keep the conversation moving so that everyone can participate. There are whiteboards at each table. I'm going to ask Ty Furman just to do a quick little tutorial on how to use them. You can write on those whiteboards as notes from the conversation. Those will be saved, and we will share all of those notes after this meeting. And when we come back together in the large group, I'll invite everyone here to take a minute or two to post something in the chat in terms of what you would like to see moving forward. And we'll collate all that together and also share it with everyone after the meeting. If we have time, and we may not, we'll also hear from maybe 3 or 4 moderators to share one highlight from their group. So Ty, let me pass it to you to share how the whiteboards work. And then Sarah, when we as speakers disappear, you will automatically be at the tables for your discussion. So take it away, Ty.
Thank you, Nancy. Yes, I can't really share the whiteboard in the speaker presentation as well. But once you're at your table, one of you, any of you you'll see at the bottom of your full screen of the Remo page, it will say whiteboard. And if any of you clicks on that and opens it, it invites everyone else to join the whiteboard. And it's one whiteboard for the whole table. So it doesn't matter who opens it, who invites, one whiteboard for the whole table. Again, if you have questions or problems, please jump to the first floor, the top left table, Remo Help Desk, and somebody can help you there. Or feel free to private chat me, Sarah, or Dorothy Welsh, and we can help out. Thank you very much.
Great. So we'll have 25 minutes for table discussions. And my understanding from Sarah is you'll get a notice automatically 5 minutes before we come back to the large group. Thank you, Sarah. So really apologies for those who experience problems trying to chat with others. We place such a high value on everyone participating in some way in this mini symposium. We will try and capture, both from the whiteboards and the chat, what you've shared. So we'd like to take the next 2 minutes to ask everyone who is here to please post something in the chat about what you would like to see moving forward, 1 or 2 things about building and strengthening a network at this intersection of arts and public health, or an affinity group, or some next steps that our planning group can consider and try to move forward so there's ways for us to continue to come together. So again, please take the next 2 minutes for everyone here to post something in the chat of what you would like to see moving forward. And if you have any difficulty finding the chat, it should be at the bottom of your screen, or if it's already up, you'll find it on the right of your screen. And please do it in the general chat, which is under public chat. And take another minute. There's a lot of the richness of what will come out of today's gathering is from what we're able to collect and share with everyone. So we have some great ideas coming forward. Thank you all. And again, you can reach out to any of us and to Mary Rose Flanagan at A2RU, who sent out the original invitation with additional ideas that you have after our session today. So we'd like to take a few minutes now to hear from some of the table discussions. Again, due to the technical difficulties, not everyone who was moderator was able to both be at a table and have both their camera and their microphone working. So we'd like to open the floor. And if some of you would like to share one highlight from your table discussion, we'd love to hear it. If you would like to do that, please post in the general chat, in the public chat, and then Sarah can unmute you and bring you to the floor to share, again, one highlight from your group discussion. And I believe Amy Bucciarelli at table, I think you're at table 8. I think you are already on deck to share something. So Sarah, can you bring Amy to the floor, and I will sign off, and then I'll look in the chat to see who else.
Hello, greetings from Florida. We've just made it through a tropical storm today. I hope everyone else who's in Florida is also safe. So our group had some really interesting discussions around how the structures of academics, particular on the social science and health sciences side, has some limitations in integrating arts and public health curriculum into that into their own curricula because of accreditation. And so that would be something that we would want to closely look at as we move forward, although it was noted that the certificate programs are the first step in the right direction for that. So that generated quite a bit of discussion. And just as we were ending, we were talking about the idea of environmental health, environmental equality, and environmental epidemiology, which was very interesting to everyone in the group. So that is really the update from the group that we had, but a lot of really interesting conversation and a lot of enthusiasm for this work and for coming together, collating us as professionals together to do this good work. Thank you.
Amy and your table. Let's see who else in the general chat. Sarah, can you see who's in the general chat to bring to the stage to share what came out of their groups? Okay, Jamali, Tejas Lieberman can share a thought. I believe Jamali was at table 12.
Hi, everyone. Yes, I would like to share we had a very rich discussion with lots of very profound and inspiring thoughts from our group members who ran the gamut from artists to academics and practitioners. So it was just a joy and an honor to moderate that conversation. As we were finishing up, one of our members mentioned this idea that she was hoping that we would find a way moving forward to create space and place at the table for artists as we move forward in the pathway of arts and health and community health and public health. And that, for the moment, we aren't necessarily engaging with artists as meaningfully as we could. For example, with artist in residence programs, as well as potentially engaging with artists in terms of developing a new pedagogy in higher education for arts in public health. So making sure that as we move forward as academics and public health scientists and practitioners, that we don't leave the actual artists behind.
Do we have someone from another group that would like to share? Please just make a note in the chat, in the general chat, and Sarah can connect you with the screen. Rebecca Moore, and can you tell us, put in the chat what table you're at? Sarah, can you find Rebecca Moore? There we go.
I'm here. I don't remember which table I was at. I was with Shanae Birch and I believe Ellie. There we go, number 6. Yeah, thank you so much, Jamila, for those comments. That came up in our conversation as well. And I think sort of connected to that is thinking through how public health crises affect the artists. And so as we prioritize their involvement, also figuring out what they need to continue to thrive. We also talked about the challenges of methodology. So as someone from a humanities background, for example, entering the public health sphere requires basically shifting gears completely in terms of research methodology and also how I frame outcomes. So yeah, we were just wondering to what extent, and maybe this happens at the level of pedagogy, but to what extent these methodologies, mixed methods, can be taken seriously and recognized when what we're trying to measure is so incredibly difficult to measure, especially at the community level.
I encourage people to still continue to write in the chat. We listen to other folks and hear new ideas. Feel free to add more ideas to the chat. We've got about 5 or 10 more minutes, so we can hear from more folks about what you talked about at your tables. Do we have another volunteer? Just put a note in the general chat, and Sarah will find you at your table, because we've got such a richness here. And I'm not going to read it all, since everyone can go into the general chat and scroll down. But we've got ideas about political action and ideas about research and cross-collaboration, ideas about influencing CEEF, the Council on Education and for Public Health Schools, which is the accrediting body, working with Healthy People 2040, which is government vision for public health and health in this country. Who else do we have who'd like to share a little bit about what was discussed in your group? Or other ideas that you'd like to share? The floor is open. I saw a rich conversation, Jill, at your table. It looked like there were a lot of people at your table talking. Does someone from that table want to share a little bit about what came out of your conversation?
Moderator of that table to share. Alana, would you like to jump in? You're gonna and your camera. We might have lost Alana. Yeah, anybody else from that group can jump in, but it was an incredibly rich discussion. People talked a lot about education at the end and interest in the development of education programs, which I'm seeing in the chat. Mm-hmm. People talked about the power of the examples of community engagement. We also talked about the Healthy People 2040 thing there. Another great idea came forward, which was really specific resources with guides specific to things like prompts that you can bring to meetings that combine community members, public health professionals, artists, so those cross-sector collaborations that we're talking about, guides to prompt dialogues and discussion, which I thought was a really brilliant idea. I loved the specificity of that. So I'll turn my camera off and let anybody else jump in who would like to.
So thank you for that, Jill, for summing up the conversation at your table. And again, everyone, we're going to capture everything in the chat and the whiteboards from your table discussions, and we'll put that all together to share with all of you with the intention to really create opportunities for us and many others to come together over time to continue to build a field together. There's a wonderful foundation that has been created by those of you who have been working in the field for a long time, some of whom are present on this call today, and then the work that has been happening over the last several years that Jill in particular shared. And I'm thinking about the vision that Sandro Galeo shared with us early on in his first statement, which was arts can and should be at the heart of the public health enterprise. This is all, if we're going to change the world and continue to change the world, it's all about how we come together in community and how we live into our values of social change and justice and equity. And arts, I can think of no more powerful way to do that, especially in these times, than through the arts. So thank you all for joining us today. I'm going to turn now to Jen Beard, Jennifer Beard, our colleague at Boston University, who started out as a host with Ty Furman, who will wrap us up for today's session. And again, thank you everybody for joining us and for tolerating some of the newness of this platform and for all the richness that each of you and all of us is bringing into the world through our commitments to both arts and health and well-being and public health. Thank you.
Hi, everybody. It's almost hard to focus on talking because I'm so mesmerized by the chat. But I'm just going to talk for a few minutes about some of the lines that stood out to me. Nancy just said something about continuing to build a field together. And that brought me back to Jill saying, you know, we set out to make arts and public health a thing. And we think we've done that. And the conversations that we've had today are a clear sign of that. And then going back to Sandro's opening talk, the idea that Nancy just spoke of the arts being at the heart of the public health enterprise, and then his 3 points about how do we get there, that we have to bridge the gap, we have to reach out and really speak to one another and draw one another in. And I think that Kendra talked about that in a really wonderful way. I love that phrase, an ear to the earless, giving an ear to the earless as opposed to a voice to the voiceless, because we need to work on our ears and we need to work on our eyes, especially I think within the sciences. The second point he made was that we need to take a long-term view, that we need to start training children early in the life course to understand health and the arts in a different way and in an integrated way. And then this whole point, and this is the thing I keep posting about, and that we talked about in our group, which is cross-training and the importance of that, and you know, sort of figuring out ways to get through to accreditors of schools of public health and other sort of health sciences programs to make it clear that a rich and useful sort of public health education is not all about sort of measurable competencies, that there's a whole other world out there, and that the notes from today really bring that, I think, to life. So I'll end there because I could keep rambling for a while because I'm feeling truly inspired. And I think that I'm supposed to remind you, but Mary Rose or somebody might want to jump on, that we will be sending out a survey, a post-program survey, and we would love to hear your thoughts about that. And that there are, I think, some ideas about developing some community groups to continue to talk about this. So please be watching for that.